There's something called the cycle of addiction that kind of shows the cycle that this goes through. We could pull that up right now and take a look at this here. And it shows how the addiction starts and how it continues. Go ahead and talk us through this.
Okay, so the cycle doesn't always happen like this, and it could get sort of mixed in, and different steps can go anywhere. But let's just start where we're okay. So triggers. If we were to want to start somewhere, we can say, okay, an individual has different triggers in his life. It could be certain stressors. It could be things in their environment that lead them to then feel a certain emotion, which they then try to cope with, and they've learned to cope with using. Of course, then that leads to those are the tempting thoughts. The tempting thoughts are, I can, this medication, I want to say, is how the individual can, how it almost feels at the time. It's going to make me feel better, which leads to then to the substance use, which leads to indulgence. By indulgence, I want to say just a person is overusing it, or using it to an unhealthy, especially when we're talking about alcohol. The defeated thoughts, the person starts to then feel that they can't do anything about it. And this happens a lot because we stress too much the idea of willpower, the idea of morality, the idea of choice. And that's what leads individuals to have these defeated thoughts, which then lead to guilt, which eventually, we hope in most individuals, it can lead to abstinence, to not using. But this could start happening all over again. The cycle can happen all over again. I will say using again, it's very much, can be very much part of the substance use disorder. But a reason there is that sometimes we treat just the substance use disorder and we're not treating the underlying issues.